we need to make sure that that drug is not more harmful than beneficial, because so oftentimes that is the case. Hi, it's Dr. Casoni. Recently, I did a post discussing the side effects of Wegovy, which has become a popularized weight loss medicine. But I wanted to take this opportunity to talk about how to look up side effects. So we've reached a point in time where when we are prescribed a drug by a medical doctor, we have to advocate for ourselves. We have to double check and ask questions, because we need to make sure that that drug is not more harmful than beneficial, because so oftentimes that is the case. It's really such a circus nowadays to think that we have to safeguard our health against our medical doctors while still sorting through the times that we actually still do need their help with something. But that's where it's at. In the last 5 years, especially, I've seen an alarming trend of pharmacists stepping in to patients, and the patients telling me these stories where the pharmacist told them, you can't take this because it'll harm you. That's been given to you by the medical doctor, or you can't take these together, or you can't take it in this range or this dosage range. So the pharmacist nowadays is saving the day. So that's where we're at. So a lot of times when I have patients come to me, their very chief complaint actually might just simply be a side effect from a drug that they're on that they absolutely don't need. We're given drugs quite often that we don't need. They're not fixing anything. They're addressing a symptom, and there's no treatment of the root cause. That would be the definition of they don't need it. There are drugs that people do need, which might be life-saving, which might be a threat to their health or their safety should they not take it. I'm not talking about those drugs. If there are side effects for those drugs, sometimes we have to take the side effects because the risk to benefit ratio assessment is in favor of taking the medication. But we know that a lot of times it's not the case. We're given stuff we don't need, and then we're given more drugs and more drugs and more drugs until you feel terrible and you finally call us up because you need holistic care and you need somebody to sort out what's going on. So if I notice that the person's chief complaint might be a side effect of their drugs, I show them the side effects, or I might know them because that's very common. A lot of the common drugs that are prescribed have the common side effects, like, for example, the statin drugs. So often for lowering cholesterol, they damage the liver, but they cause a lot of joint and muscle aches, especially muscle aches. So the person feels like they're aging, but they get off the cholesterol meds and they feel like 20 years younger. They just feel great. So nonetheless, there's some wiggle room there. Of course, they have to go back to the prescribing doctor to have that prescription modified, but it's not like you're going to stop taking a statin drug and have a heart attack overnight. So there is some room there for experimentation with the prescribing doctor. Now, when we look at Wegovy, what I want to teach is how to look up the side effects. So here we have on our screen now Wegovy, and what you can see are the side effects here. And these side effects are nausea, heartburn, vomiting, diarrhea, stomach upset, abdominal pain, bloating, gas, and then hypertension. We're going to separate out the hypertension for a second there. What I want you to think of whenever you look through side effects is just ask yourself what system is being irritated. What system? For example, if something makes you urinate more, well, we know it's the kidney to bladder urogenital system, right? So that way, if we see symptoms that the person's feeling that aren't listed, but they're in that urogenital system, we know it's potentially related to that medication. So clearly with this drug, it's the gastrointestinal tract symptom. So for example, hiatal hernia is not mentioned on this list, but a hiatal hernia is clearly a problem of the gastrointestinal tract. So if somebody has a hiatal hernia or prior history of one and it's irritated, that is not listed, but that absolutely could be a relationship worth investigating with the prescribing doctor, because technically I'm not going to tell anybody not to take or to take a drug that another doctor prescribed. That's unethical, and I always refer people back to their prescribing doctor. But this is an educational moment. Think through the system. So if you see diverticulitis, showing up in your history. You've had that, and now you have what you think might be a flare-up after taking this drug, and it would be pain probably on the lower left quadrant, because that's the descending colon and where we kind of back up and irritate things until we have a bowel movement. So that's where we're going to typically get the diverticula, which is a little pocket in the colon. And if that gets irritated, starts to get painful, could it get infected? That's called diverticulitis. It's now inflamed, possibly infected. So if that's acting up after you've taken this medication, well, we don't see that on the list, but that is a problem of the GI tract, and so very likely there is a relationship there. Same with even like, let's say you were burping more. Well, it does say gas here. Now, just think, my main theme here is think of the system, and then you can connect the dots. Now, with the hypertension is typically caused by congested liver or kidneys, because those are the two big filters in the body, right? You have a filter that's congested on your garden hose, and it's going to drive the pressure up in the hose, right? So that's liver and kidney as really common backgrounds for the cause of an increased blood pressure. However, the third one that I commonly see is the portal vessel is congested, and that's going from the intestines to the liver. So if there's a lot of gut issues, you're going to see person having blood pressure issues, and it could be portal hypertension. So knowing that this medication affects the GI tract so obviously, then I would imagine that that's probably the link there, that that type of hypertension is probably portal hypertension. And once again, we end up with a gut-related symptom. Anyways, I'm here to teach you physiology, pathophysiology, how it all works so that we can eventually get to herbs and you know how to use them. And I hope you enjoyed this, and I'll talk to you more later. All right, bye.